We will do our clinical scenario on a wing scapula. So first we'll talk about the serratus anterior and introduce its movements and its actions around the joints. And then we'll talk about what happens when the serratus anterior is nerves to the serratus anterior are damaged or there's muscle weakness and how that impacts daily life. The serratus anterior runs between the anterior surface of the scapula and the ribs. The proximal attachment of the serratus anterior are on the external surface of the ribs at the approximate mid-axillary line, so that'd be here, ribs 1 through 9. And the distal attachments run from the superior to the inferior angle of the medial border of the scapula. The serratus anterior is innervated by the long thoracic nerves. The serratus anterior moves the shoulder girdle, which is here, at the sternoclavicular joint and the acromioclavicular joint.
Here's the anterior view of the serratus anterior, running between the ribs and the scapula. From this view, you can see where it would attach to the rib cage if it came all the way around. You can also see the nerve innervation from the long thoracic nerve, which is composed of C5, 6, and 7 posterior division fibers. The serratus anterior moves the acromioclavicular and sternoclavicular joints. These two compose the shoulder girdle. The serratus anterior is a strong protractor of the shoulder girdle. The inferior fibers, which compose the lower 1/3 of the muscle, depress the shoulder girdle. It is an important muscle in upward rotation of the glenoid fossa along with the trapezius. This means that the serratus anterior is involved in both flexion and abduction of the arm. The serratus anterior is more critical to full flexion than full abduction. The trapezius is more critical for full abduction. The muscle is essential for stabilizing the shoulder girdle and movements of the upper limb, especially full flexion and full abduction at the shoulder. Here is the posterior view of the serratus anterior. From this view, you can see it passing posterior to the ribs, which are right here, and anterior to the scapula. You can also see it attaching to the medial border of the scapula.
Alright, so now actually palpating for serratus anterior on a human. So we have our volunteer Haley here along with Mr. Bones to the side. So we're going to start off by looking at the scapula. So Mr. Bones demonstrating right here. We have the scapula right on top of the ribs. So if we're going to find that on an individual, it's going to be right here in comparison. And as we talked about before, serratus anterior is going to start at the vertebral border. So on this example for the skeleton, it will be right here. So corresponding, it will be right here anteriorly. When the serratus anterior is properly working, it should be able to complete a multitude of actions around the sternoclavicular and acromioclavicular joints. Around the AP axis, it will be able to depress the shoulder girdle. Along the vertical axis, serratus anterior will perform protraction. And through the oblique axis, it will aid in upward rotation of the glenoid fossa. In addition to serratus anterior allowing these movements at the shoulder girdle, it also plays a major role in allowing the scapula to be held in its anatomical position against the posterior ribcage of the trunk, like we displayed before. This position is very critical because it allows the SA to act on a third imaginary joint called the scapulothoracic joint. The scapulothoracic joint refers to a plane of movement, which is actually found between your serratus anterior, where it sits on the ribs, and the subscapularis muscle that sits on the subscapular fossa of the scapula on the anterior side. This is actually very critical because it is where most everyday movement occurs in the shoulder, and therefore being a very important role in daily functioning.
Abduction and flexion will be affected because there is no stable base for GH movements, and the serratus anterior no longer contributes to the scapulohumeral rhythm. Full flexion range of motion will be lost since it is the primary role of the serratus anterior, but full range of motion for abduction will remain since the trapezius is still functioning. The serratus anterior is also critical to maintaining appropriate positioning of the scapula, and therefore the entire shoulder girdle. The notable wing is a result of the posterior movement of the medial border of the scapula, since the serratus is no longer able to keep the scapula closely applied to the body wall. The winging would be especially prominent when the individual abducts or flexes their arm, since during both of those motions, serratus anterior is active in holding the scapula in place. 2 ways to test for a winged scapula. The first is to have the individual abduct their arm above 90 degrees. If the serratus anterior is paralyzed, it would be very difficult to reach this 90-degree mark, and the scapula would be winged. The second way is to have the individual push against a wall with their flexed arm. The scapula will also wing, and they will not be able to do a push-up. In the previous example, Haley's serratus anterior was properly functioning, so she didn't have a winged scapula. However, in this example, the individual is pushing against the wall with both arms. This is the normal scapula that is not winged, and this one, the serratus anterior, is damaged. You can see the winged medial border. Now that we've covered a properly functioning serratus anterior and all of its actions and insertions, I'll cover what happens when the serratus anterior is not working properly. So this image is a picture of a winged scapula, which can occur from nerve damage or weakened muscles of the serratus anterior. When the serratus anterior is paralyzed, all of its actions can be impacted, such as upward rotation, protraction, and depression.
Hi Matt, I'm here to give you a better idea of what a winged scapula is, because you've been diagnosed with one. You've probably been hearing a lot of anatomy terms, so I'm here to answer any questions you have and just give you a better idea of how your life will change. So you've probably noticed that your scapula or your shoulder blade kind of protrudes in the back or sticks out. This will cause some possible pain when putting weight or sitting against your shoulder blade in a chair or other, maybe laying. Some other weaknesses you'll probably see is when you push, pull, or lift yourself or other objects against gravity or resistance. So some examples may include doing a pull-up or a push-up, using dumbbells, reaching above shoulder level to retrieve objects, or difficulty with respiration.
Thanks for watching!